that's an area where, I would say half of the money is, but people are not really looking with a due level of attention. So the brain, is, kind of historically is considered this kind of, high fluid thing, where it does everything by itself and so on, which is not correct, because think about, what happens when you have a cardiac arrest. How long does it take you? 30 seconds for you to be a vegetable, all right? Or, maybe a couple of minutes, and you're going to be a real vegetable. Okay, so the brain is very, very, very dependent on the other organs, and this dependence is multi-mechanistic, is varied, multifactorial. So there is a blood vessel link, all right, the heart and the brain. Okay, hypertension, major risk factor for dementia. A stroke, multiple strokes cause dementia. All right, a third of the patient who have just a regular stroke will have dementia 6 months later, So the vessels are a big deal. But there is also another aspect, which is the immune communication. So the brain is also on the receiving end of the immune system, systemic immunity, particularly gut immunity. Now, this may not be widely known, appreciated, but the gut's got more immune cells than everything else in the body. Is a huge reservoir, more than in lymph nodes, more than in the spleen, more than in the thymus, all right? Is really a major reservoir, particularly for lymphocytes. And these lymphocytes from the gut, they get to the brain, and they get into the brain, they interact with brain cells, and they come out of the brain through these efflux pathways, like the lymphatic system, which have recently been described. So there is a trafficking, of immune cells in and out of the brain coming from immune organs, including the gut. And for example, that business about the salt that I told you is mediated by the gut. All the bad deeds that leads to the tau accumulation is caused by a gut-brain axis, all right? So the gut can make you demented through the diet. Okay, for example, in that case, was the salt diet. All right, but there is also other ways in which the microbiota can make you demented. There is a number of other things that. So there is no question that the brain is on the receiving end of everything that goes on in the periphery. Vessels actually are the most kind of better appreciated because of the stroke and hypertension and so on. But there is also this neuroimmune communication factors. And then there's the hormones. So the brain is like the source of these hormones, but it's also the feedback mechanism that senses these hormones back. So for example, leptin, which is a hormone produced by fat cells in the body, it acts on the hypothalamus in the brain. And if that link doesn't work right, the hypothalamus does not do its job in setting the proper, let's say weight and so on. And this may lead to complications, particularly in the setting of obesity. And as you know the story about obesity and Alzheimer's disease, there is also a story about, being too lean and having Alzheimer's disease. So this regulation of the hypothalamus, which is driven by systemic factors, is also a component of this. So I think hormonal, neuroimmune, and vascular are three examples of this kind of interaction.